All right, good afternoon, everybody. All right, so we have our part 2 of our safety training, going over first aid review. So we got through our first 6. So let's get started on this one. So this time the video isn't quite as long, and we'll get through the information, but still do a thorough job of getting through the information. So the first part of part 2 is gastroenteritis. Well, let's find out what exactly all that means. All right. So gastroenteritis is an inflammation of your stomach and intestine. Common causes are food or water contaminated by bacteria or parasites. Could be a side effect from medications. Characteristic signs and symptoms include nausea or vomiting, diarrhea, abdominal cramps, low-grade fever sometimes, and depending on the inflammation, symptoms may last from 1 day to more than a week. So again, with everything with COVID going on, this is important. Because if you did have this, you should definitely be tested for COVID and stay home, because the symptoms are very, very similar. If you suspect gastroenteritis in yourself, you want to sip liquids such as sports drinks like Gatorade, things like that, or water to prevent dehydration. Drinking fluids too quickly can worsen the nausea and vomiting, so try to take small, frequent sips over a couple of hours instead of drinking a large amount at once. And I know a lot of times people, I tend to do that. I'll be like, no, if I just drink all of this, then in like an hour, everything should be good. That doesn't work that way with gastroenteritis. Take note of your urination. You should be urinating at regular intervals, and your urine should be light and clear. Infrequent passage of dark urine is a sign of dehydration. Dizziness and lightheadedness are also signs of dehydration. If any of these signs and symptoms occur and you can't drink enough fluids, that is when you need to seek medical attention. And it says to ease back into eating. Try to eat small amounts of foods frequently if you experience nausea. Otherwise, gradually begin to eat bland, easy to digest foods such as soda crackers, toast, gelatin, bananas, applesauce, rice, and chicken. It's kind of funny with my dog when she was here. I see, girl. Or wherever you are, maybe she's right here, and I don't even know. But that's basically what they said. It was like rice and chicken. That's what you want to give her if her stomach's upset. Stop eating if your nausea returns, and you want to avoid milk and dairy products, caffeine, alcohol, nicotine, and fighter your highly seasoned foods for a few days. Get plenty of rest. The illness and dehydration can make you weak and tired. So you need to seek medical attention if vomiting persists for more than 2 days. Diarrhea persists for more than several days. Diarrhea turns bloody. Fever is more than 102 degrees Fahrenheit or higher. Lightheadedness or fainting occurs with standing. Confusion develops. Worrisome abdominal pain develops. So that is stuff that's when you really want to seek professional advice if that stuff starts to happen. So gastroenteritis, not a joke. Next one, we're going to go with headache. So, very common thing. A lot of people get headaches. But they can be signs of other things. So, while most headaches are minor, some warn of a serious problem. Here's why to worry about a headache. And most of them you can treat with a pain reliever, Tylenol, some ibuprofen, Some headaches, however, signal a dangerous or serious medical problem. Don't ignore unexplained headaches or headaches that steadily worsen. Get immediate medical attention if your headache develops suddenly and severely, so it's just like, oh, wow, like, what is happening? Progressively worsens over the course of a single day or persists for several days and causes mental confusion or loss of consciousness. Immediate medical attention is also needed if your headache is accompanied by seizures. Yes, definitely go see somebody about that. Dizziness or loss of balance. Weakness or paralysis, just which means you can't move a limb or something like that. Such as in the arms or legs. Numbness, difficulty speaking or understanding speech. A reddened eye, so if you get like red marks in your eye, that is something you want to be, very careful of. And also seek medical attention if your headache is accompanied by fever. Stiff neck or rash is accompanied by changes in vision, such as blurring. Seeing halos around lights, not good signs. Is severe and follows a recent sore throat or respiratory infection. Again, these are parts, again, of COVID. Begins or worsens after a head injury, fall, or bump. Is triggered by changing the position of your head, coughing, sneezing, bending, or physical activity, and is a different type of headache from your usual type, and you're older than 50. Well, most of us aren't older than 50, so. Well, at least most of y'all aren't over 50. And I'm not yet either. Okay, next one. So we go over this, and this is good to go over because summertime is coming up, but we're just going to go over heat exhaustion. So our time's looking good. See, not so long. We've already got through, about to get through the first 3, then we only have 3 more. So heat exhaustion is one of the heat-related syndromes. These syndromes range in severity and seriousness from mid to potentially life-threatening. Other types of heat-related illnesses include heat rash, heat cramps, heat syncope, and heat stroke. Heat stroke, of course, being the worst. Heat exhaustion can occur when your body loses too much water or salt, usually as a result of excessively sweating or dehydration. It can begin suddenly or happen over time, usually after working, exercising, or playing in the heat. So heat exhaustion signs and symptoms include cool, moist skin with goosebumps in the heat, heavy sweating, just a lot of sweating, faintness, dizziness, fatigue, a weak or rapid pulse. So a weak pulse, not going very fast, or rapid pulse is when your heart's working too much. Low blood pressure upon standing, muscle cramps, nausea or vomiting, headache, extreme thirst, mild confusion, and decreased urine output. So you're not peeing enough. So if you suspect heat exhaustion, what should you do? Untreated heat exhaustion can lead to heat stroke, which is a life-threatening condition. If you suspect heat exhaustion, take these steps immediately. And this is for you to either do these yourself and let your staff know, of course. Or if you notice somebody else, alert your staff and then maybe help out with this. But move either yourself or the person out of the heat and into a shady or air-conditioned place. So the van is a good place, under a tree if it's a nice windy day, or in the shade of the tree though. Lay yourself down or the person down and elevate the legs and feet slightly. Remove tight or heavy clothing. And for you, sip chilled water, or have the other person sip chilled water. A decaffeinated sports drink containing electrolytes or other non-alcoholic beverage without caffeine. So caffeine is not a good thing, so no Coke, Pepsi, Dr. Pepper, any of that. You want Gatorade, water, that was really what you want. Cool yourself by spraying or sponging up with cool water, doing that for the other person, and monitor yourself or the other person carefully. So when you need to contact a healthcare provider if signs or symptoms worsen or if the person doesn't improve after taking first aid measures. Call 911 or your local emergency number if the person's condition gets worse, especially if he or she experiences fainting, agitation, just like, what's going on? Confusion, they don't know where they are. Seizures, definitely. Inability to drink, that's really bad if your body's rejecting water. And core body temperature, measured by a rectal thermometer, which we don't have, but we can use the other one. And if you're way up there, then, it's something that we would definitely call 911 for. Okay, so next up, nosebleeds. Had these, and I'm interested, because this seems to change all the time. When I was a kid, they said go like this. And then they said, no, the blood's going to run down your throat and make you sick. So, let's see. And then everybody said like this. And then some people say, no, just like this. And let's see what the Mayo Clinic says. So, nosebleeds are common. Most often they are a nuisance and not a true medical problem, but they can be both. So, nosebleed care. Sit upright and lean forward. By remaining upright, you reduce blood pressure in the veins of your nose. This discourages further bleeding. Sitting forward will help you avoid swallowing blood, which can irritate your stomach. Much different than when I was a kid. They were like, just hold your head back. Gently blow your nose. So not a big, just a, And blow your nose to clear your nose of blood clots and spray both sides of your nose with a nasal decongestant containing like an Afrin or oxymetazoline. So pinch your nose. Use your thumb and your index finger to pinch your nostrils shut. Like that. So you're talking like an operator on the phone. Breathe through your mouth. Continue to pinch for 10 to 15 minutes. Pinching sends pressure to the bleeding point on the nasoseptum and often stops the flow of blood. If the bleeding continues after 10 to 15 minutes, repeat holding pressure for another 10 to 15 minutes. Avoid peeking at your nose. If the bleeding continues, seek emergency care. Sorry, had to do it. Went a little bit long, but to prevent rebleeding, don't pick or blow your nose and bend down for several hours. Keep your head higher than the level of your heart, so you don't want to be bending over. You can gently apply some petroleum jelly to the inside of your nose using a cotton swab or your finger. So just, we have the cotton swabs in the car. And we just... If bleeding reoccurs, go through the steps again. Call your doctor if the bleeding continues. So when to seek emergency care? The bleeding lasts for more than 30 minutes. You feel faint or lightheaded. The nosebleed follows an accident, a fall or an injury to your head, including a punch in the face that may have broken your nose. Okay, so let's not fight so we don't have to ever have this problem. So no punching anybody and no getting punched by anybody. When to contact your doctor. You experience frequent nosebleeds, so that might need more attention. So it might need to be cauterized, which, there might be something open. And the cauterization is they kind of burn it shut. And then, or you're experiencing nasal bleeding and taking blood thinners. So if you are taking blood thinners, obviously you're just going to bleed longer because your blood's thinner. If it's thicker, it's going to coagulate faster. If it's thin, it's gonna run. All right, sprains is our next one. Sprain first aid, and then we just have one more after that. We're doing pretty good on time, so. Okay, your ligaments are tough, elastic-like bands that connect bone to bone and hold your joints in place. A sprain is an injury to a ligament caused by tearing of the fibers of the ligament. The ligament can have a partial tear, which is just a bit of it, or it can be completely torn and then, not good. Ankle sprains are the most common type of sprain. Wrist, knee, and thumb sprains are also common. Sprained ligaments often swell rapidly and are painful. Generally, the greater the pain and swelling, the more severe the injury is. For most minor sprains, you can probably start initial injury treatment yourself. So, we've done this before. Follow the RICE, the instructions for RICE, R-I-C-E, the R, rest, the I, ice, the C, compress, the E, elevate. So, rest your limb. So try not to put weight on, especially if it's your ankle, for 48 to 72 hours. You may have to use crutches, depending on how bad it is. My dad one time sprayed his ankle so bad it swelled over his shoe. I had to cut off his shoe, and that was much more dire, but it was pretty bad. And so just don't try to push it. Maybe an exercise bike or something. But really, yeah, you just want to, for 48 to 72 hours, just take it easy and not put anything on it. So ice the area, use a cold pack, a slush bath, which right now not the best thing. Cold pack's probably the best. Just with the drought and everything. A slush bath or compression sleeve filled with water to help limit swelling after injury. Try to ice the area as soon as possible after the injury and continue to ice it for 15 to 20 minutes, 4 to 8 times a day, for the first 48 hours or until swelling improves or goes down. And again, try not to use ice on it too long because it could cause tissue damage. Like I said, talked about it yesterday, just leaving it on there, it can cause tissue damage because you're going to get a burn, like a freeze burn. And then you want to elevate the injured limb above wherever possible to help prevent or limit swelling. And sprains can take days to months to recover from, and for swelling to improve, gently beginning using, so just go for gradual, progressive movement. Don't jump right into, I'm going to go run a marathon or I'm going to go run around the block. Take it easy. Go for, walk around the house. Once you feel comfortable with that, then you're going to want to take a walk, maybe just up the block and back, just as you feel. Take crutches with you possibly, or somebody with you to help you back if it's too painful. And then just ease yourself back into it. And it's essential to restore the strength and stability to the injured limb prior to return to sports or fitness activities. So again, take it slow, just like they do with the doctors now in sports. Back in the 80s, like basketball players, they got injured. They're like, walk it off, you'll be fine. And they would play the next day. Now they're like, not until the doctor clears you. So honestly, if you have nothing else but you have insurance, call an advice nurse and say, hey, this is what it's like. And they'll give you some good advice until you've been cleared by them, or you really know that you're feeling better. Then it's best to stick with this. When is it an emergency that you need medical assistance? If you're unable to bear weight on the injured leg, the joint feels unstable or numb, or you can't use the joint. This may mean the ligament was completely torn. And then on the way to the doctor, you want to apply a cold pack. Or you develop redness or red streaks that spread out from the injured area. This may mean you have an infection. You have pain directly over the bones of an injured joint, or you have re-injured an area that has been injured a number of times in the past. Again, this is why the first time you injure something, you want to take care of it right the first time. Or you have a severe sprain. Inadequate or delayed treatment may contribute to long-term joint instability or chronic pain. None of that sounds fun at all. But we are back down to our last one, which is toothache. Alright, this shouldn't take long, should it? Oh my gosh! Okay, so it is a little bit long, but let's see. Maybe we can go past it. Oh man. Glad I did this in 2 classes, otherwise it used to be really long. Okay, tooth decay is the primary cause of toothaches. For most children and adults, bacteria that live in your mouth thrive on the sugars and starches in the food you eat. These bacteria form a sticky plaque that clings to the surface of your teeth. Yeah, right down there. Acids produced... Sorry, I shouldn't have touched my finger to my tooth. I did wash my hands, but... Acids produced by the bacteria and plaque can eat through the hard, white coating on the outside of your teeth, which is called your enamel, creating a cavity, which we don't want. The first sign of decay may be a sensation of pain when you eat something sweet, very cold or very hot. Sometimes the decay will show as brown or a white spot on the tooth, which we don't want. Other causes of toothache: accumulation of food or debris between your teeth, especially if your teeth have spaces between them. Floss. That's what it's saying, is to floss. Inflammation or infection at the root of the tooth and in the gums. Trauma to the tooth, including injury or grinding your teeth. So bite guards, sometimes a good thing if you grind your teeth. Sudden fracture to the tooth or the tooth root. A split in the tooth that occurs over time. Teeth that start to appear erupt through the gums, such as with the teething or wisdom teeth way in the back. So I don't know, some people can have a big enough mouth they can live with them. But some people don't have enough room. So you can get an impacted wisdom tooth, which is, from what I've heard, not fun. Or a sinus infection that can be felt as pain in the teeth. So, some self-care tips. Until you see your dentist, try these self-care tips for a toothache. Rinse your mouth with warm water. Use dental floss to remove any particles of plaque wedged between the teeth. Consider taking an over-the-counter pain reliever to dull the ache, but don't place aspirin or other painkiller directly against your gums because it may burn or your gum tissue. Yeah, because there's some power stuff. Usually when it goes into our stomach, the stomach acid helps dissolve it. If it's right on your face, it can actually cause some bad things. So just, be careful. Don't put it right on there. There's also stuff, lidocaine. If you put lidocaine on there, it numbs it. And so if you have like a cold sore or something like that, you put lidocaine on there, and it takes the pain away for a little while, it numbs it. But then it'll come back, but, at least it won't be painful completely for a long time. If your toothache is caused by trauma to the tooth, apply a cold compress to the outside of your cheek. And so it says use caution with products containing benzocaine. So you'd want to talk to your doctor before you would actually start using something like benzocaine. Don't use products that contain benzocaine. And never use more than the recommended dosage of benzocaine. Store products containing benzocaine out of reach of children. So it's benzocaine. Okay, and this is when you need to call your dentist. So if you do all this and the toothache's still there, so if you still have pain that persists for more than a day or two, you have a fever, you have signs and symptoms of infection such as swelling, pain when you bite, red gums, or a foul lasting discharge, or trouble eating or swallowing. Those are all things that you're going to want to do. Sorry, the class took a little long. But if you have a toothache, they can be unbearable. So these are some good tips. Okay, so that is our class for today. If you have any questions, comments, concerns, anything that I was unclear on, again, you can always go to the Mayo Clinic website. They will explain everything to you. So I hope you have a fantastic rest of your day, and none of these things will affect you, and you'll be good and ready to go. All right. Have a wonderful day, everybody. I'll see you all soon.